So after the nurse assigns the patient to a doctor, the doctor can see all the patients that have been assigned to him on his assigned to me page. So as a doctor, you click on the navigation bar, go to doctor, scroll down, and you click on assigned to me. So this is the patient you want to start treating. You click on the image to open treatment. So the first thing you you ask the patient for symptoms, history, then you write it down, or you can click on this list of very common symptoms that people complain about. So let's say this patient complained of headache, fatigue, sore throat. So you click on the last one, then it adds to the list. After adding it to the list, you click on this button here to add it to the patient history. Then after taking the patient's history, the next thing, the doctor begins to examine the patient and sees things that he is noticing about the patient. So again, you can write down what you're noticing, or you can check the list of common things that doctor sees when he examines a patient. For example, the doctor sees that the patient's hair is dropping. The doctor sees that the patient has red eyes and the patient has skin burns. So you click on the last one. You've added it to the page. Then you click on this add button to add it to the patient's examination. And after it has added, you see a message that says patient examination details submitted successfully. The next is the investigation. Investigation is when the doctor decides the type of test that the patient should carry out. So to be sure of what is wrong with the patient. For example, this doctor has decided that he wants this patient to do an HIV test. So there are a list of tests that are carried out by patients. HIV. So the price and everything is here. You just click on it, then you click on this box again to add it to the patient's details. You see the message that shows one row recorded successfully. So the doctor will then have to wait for the lab technician to bring the result of this test before he goes on with the patient's treatment.